Well, Ebola is caused by a virus that produces a hemorrhagic fever. Over time, as the illness progresses, people will move from just having a low-grade fever and something that's, looks pretty much like the beginning of a cold to a situation where they have diarrhea, where they might be vomiting and losing blood from various parts of the body, like the urine and in their feces, and so they get quickly dehydrated and may become anemic as well. The Ebola virus is found in the blood and then in the body secretions that contain blood as well. So it would be present in the vomit, it would be present in the nasal secretions, it would be present in the feces and the urine of that person, and it would be present also in breast milk and semen. Unless you have contacts with those contaminated fluids, there is no risk of transmission. It's not a virus that would be transferred, for example, in the air. So most of the people who are infected have provided direct care to somebody with Ebola, or touch some of the linen or clothing of the person that was soiled by body secretions. Our healthcare system needs to be prepared for situations where somebody who's traveled to a foreign country might have brought back any virus that can cause a severe infection. And we know in Canada we've dealt with in the past with things like SARS, bird flu, H1N1, there's other disease. So Ebola is just one of those where somebody who travels to a country where the disease is present can bring it back. And so initially what's important is that we screen the patients that may present with symptoms to a healthcare establishment like an emergency room, and isolate the individuals until they can be transferred to a proper setting, which in our case would be a tertiary care hospital down in one of the provinces like Alberta, and making sure that the staff who has the initial contacts with the patients are using personal protective equipment. There's also many steps that are taken to prevent somebody from those countries to travel all the way to the Northwest Territories. So there are border checks that are made if somebody has traveled from Liberia or Guinea or Sierra Leone. They are checked at the borders when they come into other countries, and if they have symptoms, they would be quarantined right away and transferred to a setting where they can receive care. If they are asymptomatic, they may be allowed to continue their travel, but we would monitor them during the period where they might be infected but not yet sick. That period, which we call the incubation period, is thought for Ebola to last up to 21 days, although in most cases people become sick within the first 10 days of having been exposed to the virus. There's very small risk here because there are so many barriers for traveling between the three affected countries and Canada. First of all, there's no direct flights between West Africa and North America, so people first have to find a way out of the three countries, then get a commercial flight to places like somewhere in Europe where they're going to be screened again, and then they come first to one of the bigger airports in Canada like Toronto or Montreal or Vancouver or Calgary, where there's going to be an additional screen, and then they'll be identified as at risk, and the Office of the Chief Public Health Officer here in the NWT would be notified of returning travelers who may have had exposure, and we can take some additional measures under our own Public Health Act to make sure that they are properly monitored and don't spread this infection in smaller communities. If you haven't traveled to at-risk country, then your symptoms are probably more likely related to something more common like influenza, which we're about to enter into the flu season, or if you've traveled to a holiday destination where you might have caught a traveler's diarrhea or other more common practices. But if you have traveled to or from one of those 3 countries, then the first step would be to stay home initially, call the emergency room or the health center where you're staying, in the community where you're staying, and wait for further advice about where you should go next. So that would be the first step. Well, right now the recommendations from the Public Health Agency and from the World Health Organization is that nobody should travel to the 3 affected countries, that is Liberia, Guinea, and Sierra Leone, unless they absolutely have to. So that might be, obviously we have healthcare workers from Canada, nurses, doctors, lab workers, and others that are going there as part of the relief effort, and they will be properly prepared and trained to deal with the Ebola patients. Or some people might have family there and they need to go because of a family situation that is taking place there, or other people are going because they have business to conduct there that cannot wait. But that's the basic recommendation, is that you should not travel to one of the affected countries unless absolutely necessary.